Hello and welcome to another episode of Clean Talk. Today is June 1st and it is 3 p.m. Eastern time. And that means we're coming to you live from beautiful sunny Florida for another episode of Clean Talk, the infection control podcast. Very excited to have my guest today, Justin Poulin, who's the CEO and co-founder of Beyond Clean, a man with a mission very close and dear to my heart. Justin, welcome to Clean Talk.
Thanks, Brad, for having me. And, this is one of those unique situations where you get two podcasters together and, we got the high technology and we've got the experience. I think it's going to be a great episode.
Absolutely. Well, Justin, I really appreciate you being on the show today. And as you mentioned, we both have infection control, healthcare related podcasts. And maybe you can tell our audience a little bit about what you do and why you're on Clean Talk today.
Yeah, so I have 4 different podcast brands that I've launched, and I really should say media brands because we're experts in social media, both on our own brands, but also on the consulting side and podcasting. We do lots of virtual and live events throughout the year, lots of content creation. And so the 4 brands is Beyond Clean, which is focused on sterile processing. That was the flagship and the proof of concept coming up on 5 years this August. So
congratulations.
Thank you very much. And it's been a very rewarding experience. And then because of its success and because of conversations with many of our partners, we grew out into 3 other brands and started launching them about 18 months ago with First Case for the operating room, Power Supply for healthcare supply chain, and then probably one that's very near and dear to your heart, Transmission Control for infection prevention.
Well, fantastic. We want to talk about all of those. I know we're going to dive into each of those subjects, but maybe you could tell our audience a little bit about your background. I know you have a clinical background and how that led to you founding Beyond Clean and doing what you're doing in the podcast community.
Yeah, so I am a registered nurse. Originally I was going to be a chemical engineer. I got a full scholarship to the State University in Maine. I grew up in the great state of Maine and thought I was going to be a chemical engineer and went off to school. But the summer before that, I was looking for employment and I wound up working at a camp for mentally and physically disabled children and adults. And so I worked in the kitchen, but I wound up spending a lot of my free time working with the other counselors and the campers in the different cabins and really got myself immersed in that environment. It was a ton of fun. When I went back to school, I didn't fare so well right off the bat. I'll even just tell you I got a 10 on my first chemistry test, which does not bode well for somebody who wants to be a
10 out of 10.
I wish. Class average was 30, so maybe not as bad as 10 out of a 100 sounds, but yeah. So I kind of started to reevaluate a little bit at that point, and I thought to myself, I loved working with these kids. I had a great time. Nursing's going to pay a little bit better. Maybe not as much time off during the summer, but if nursing doesn't work out, I could always be a teacher. So just kind of know in the back of your mind that, the idea of being an educator was always on my mind. I chose nursing. I wound up making Dean's List when I came back the next fall. I went to work at that camp for 4 more summers after that first one. And I basically started doing patient care, everything but IVs that the parents would teach you to do. With those kids at 19 years of age. So when I got to clinical rotations in nursing, I was really just not shy. We're very well prepared for that. Wound up moving into a number of different roles as a nurse, including home health, hospice, psychiatric nursing, inpatient nursing, medical necessity review, a number of different things. And then when I left the great state of Maine and moved to Pennsylvania about 14 years ago or 13 years ago, I started looking for a career in sales. I knew that I really liked the interpersonal connection. I knew that might take my career to the next level. And I did wind up landing with a company that did instrument repair. And so the company's focus was very much educational. They wanted the sales reps to get certified in sterile processing, to be able to deliver education directly to those departments. And competency and knowledge outside of even what we did every single day in terms of our service was really, really important, big picture understanding. So after about a year, I started to do those educational programs And we were supposed to present in our booth at AORN's annual conference on the national conference. And they designed the booth around doing in-booth education. And then at the time, Fiedler had taken over kind of that process for issuing CEs. And there was a rule that got set that you had to be a nurse to deliver the education. I was the only nurse on the team. So the next thing I know, I'm presenting at AORN's annual conference, and the rest was kind of history. Began to do a lot of education on behalf of that company, grew into a regional sales and operations role. And when I left that company, I joined my business partner in another business I have, which is a vendor credentialing business. And when I entered into that entrepreneurial space, he kind of told me, like, listen, spread your wings. Now that you're an entrepreneur, you should do lots of different things. You should be creative. You should fulfill your potential. And people had always asked me, and we can get into this part of my history at some point. They'd always ask me, like, you do this podcast for fun. How come you've never done it in healthcare? And as soon as I moved into this entrepreneurial environment, that's when I took the leap. And at that point, I didn't feel like, oh, I've got one employer. And if they don't like what I have to say on the podcast, I might lose my job and not be employed. That was always the hesitation. Once I had that freedom to really pursue my interests as an entrepreneur, that's when it all took off from there.
Well, there's a lot to unpack there, and I'm full of questions, but let's take it back a little bit to your career as a nurse. How long were you practicing nurse?
Yeah, so I worked as a CNA while I went to school from 95 to 99. Then I practiced as a nurse for about 10 years, 99 to around 2009, 2010. And then in 2010, I made the move into medical sales and ultimately have been either a business owner, or a VP, CEO, et cetera, of these businesses for the past 7 or 8 years.
Well, I'll tell you, we're always looking for great clinical background salespeople. So if this whole podcast thing doesn't work out for you, be sure to give me a call.
Absolutely.
I'm wondering at what point, as you were practicing nurse, you mentioned that you got into the continuing education and you were doing some of the continuing education with AORN, which is the Association of Registered Nurses. Was that kind of the catalyst for, hey, I can take what I've learned and my observations in nursing and apply it towards education and information? Or what was kind of the moment where you said, hey, I can share this?
I think honestly, as I moved into that, medical sales role, a lot of nurses, when they come in, and you may have found this just even as you've looked for clinicians who have sales aptitude, the person who kind of decided to take a risk on me, not having really much prior sales experience, said, I'm going to take him out of the scrubs and put him into a suit, and we're going to show him the way. There's some sales reluctance in terms of, am I really providing value or am I pushing a product? And I think that's a hesitation in the industry. That wasn't the first job I'd applied for. Even though I took a medical sales job in 2010, I had applied over a number of years and never made it through the first interview. And I think it's because there's a perception that you're really a more of a shift worker, 7 to 3. How are you going to deal with all the things that salespeople put in on the extra time and the variable compensation and all those things that come with making the move into sales, right? And so I did have some of those. Not necessarily, the work ethic wasn't an issue. The variable comp wasn't really an issue for me. The biggest thing that was an issue for me was, am I really providing value? And so the tool for me to feel like I was doing something of value outside of selling my product and the service was to provide education at no charge. It's how I created new relationships. It's how, I knew that, I was doing more for the organization. I was almost like part of the team in helping them institute process improvements. And I also realized that another value as a sales representative was to help connect customers to other, members of your network, other customers who have gone through the same thing, like really just becoming a valuable resource. So education was really the key component. It was more in the sterile processing world at first. I think the reason that I started to, obviously I got thrust into this one situation when the company needed a registered nurse to present at AORN's annual conference. But the other reason was that I found that nurses tend to only listen to nurses. And I don't mean that I don't mean that in a real negative way, but I can tell you that I would go and it's a fact. And I would go present education to the perioperative nurses. And I know that their sterile processing partners had likely told them many of the things that I would tell them, but I just felt like I could be a champion for sterile processing in the operating room. So not only was I focused on educating and bringing value, but because I was a nurse, I also realized that I had a unique ability to communicate some of the things that I knew was important to driving the sterile processing industry forward to their internal customer, their true revenue generating department, which was the OR.
And so now you've taken your clinical background, you're in a sales role. At what point does that entrepreneurial spark kick in and say, I could provide more value doing things the way I want to do things. Here's the opportunity I see. I want to start something on my own. When did that happen?
Yeah. So what's interesting is that actually happened long before I left nursing. I don't think I realized that I was an entrepreneur. But I started a podcast covering the Boston Celtics. I networked my way into the locker room. Was the first member from new media, blogging, podcasting, to get credentialed access to the locker room to cover the Boston Celtics. I was there when they won the championship in 2008, and Kevin Garnett, looked up at the ceiling and said, anything is possible. And honestly, when he said that, it was the culmination, of a lot of hard work and effort. Some of our biggest audience, biggest members of our audience for this show was called Celtic Stuff Live. We're from Australia and Italy, and they didn't have exposure to people talking about the Boston Celtics, and the internet was their way into that. And there's a whole group of, media personnel that have now followed a non-traditional path. Some of them, starting in high school and getting credentialed access to the Celtics, that kind of nicknamed me the Podfather for blazing the way for them to get that to get that access. And so I think the recognition of myself being an entrepreneur was super latent. I just didn't see it. I was doing it, but I didn't see it.
It took Kevin Garnett saying anything is possible, right?
So when Kevin Garnett said that, I knew it was true, because if you're willing to do something for free, you can likely accomplish it. I think one of the things that holds people back is they say things like, I don't want to do that unless I get paid. And, that means you're not an entrepreneur. Anybody who's ever launched a business knows it can take several years to make any money. If you even succeed, you might never make money. You've got to be in it for other reasons. You've got to have a higher calling. If you're going to start a company, you have to really want to solve a problem that exists in the industry, because you'll never get over the tipping point. Hat tip to Malcolm Gladwell. You'll never reach the tipping point if you don't have the passion to carry you through. I'm sure some people get lucky, but by and large, most entrepreneurial efforts don't succeed. And it's the passion that gets people from point A to point B. When you're down, you can get really down. And sometimes you hit these make it or break it moments where you look back on the history of starting a company and you realize, wow, I'm glad we didn't make that decision, because if we had made that decision, this wouldn't be today. Anybody who's ever been an entrepreneur knows that's the case when they look back on the success of their company. And so, that was one area. I think when I started building my market, because really we had very limited presence when I got hired by the instrument repair company. And as I built out that market, it was very entrepreneurial. And even though my role was sales, I immediately got involved in operations because I knew that was going to be key to my success. So something that happens in a lot of companies that also results in if not failure, a real incongruent message to the customer is not aligning sales and operations. When they start telling two different stories to your customer base, and sometimes that's just internal customer service is all the ops is, right? If you're selling a product. But when those messages are incongruent, it can really cause, a lot of problems. And so I made sure to really establish myself as a leader. It wasn't until my business partner in the vendor credentialing company, Green Security, reached out to me, and he had been my former VP of sales that I reported to at this company after several mergers and acquisitions. He reached out to me and said, Justin, you've got clinical background, you've got technical aptitude, and you were one of the best sales regional managers and regional VPs that I ever had. I want you to come join this company. We just got some agreements in place. I'm ready to launch it, and you're a perfect match. It wasn't until he told me that I should be an entrepreneur that I actually became one.
Well, I think it's interesting. We could talk all day about some of the semantics around entrepreneurship. You're really preaching to the choir here. Interestingly, I've had some guests on the show who have a clinical background and are founders of companies. They've developed some amazing technology, and sometimes they're unwilling to admit that they're entrepreneurs, that they feel that there's some negative connotation because of all the things you said, that if you don't have the passion, if you don't have a mission, it's not just a job that you get hired for as an entrepreneur. There has to be a driving force. And that brings me to, your mission. And what is it that really inspired you to go into this specific area? I know it started with sterile processing. Was there a catalyst, or did you just see the need there? Why that area for Beyond Clean?
Yeah, I mean, specifically for sterile processing, it's just a very unrecognized, unknown function in the hospital, and specifically surgical services. I don't think the general public has a real good understanding, or even probably don't even know that this department exists. What's interesting is a lot of the technicians that work in these departments are, working below the poverty line in terms of wage and pay scale, and yet their jobs are highly technical, involve a high degree of stress. Most of the departments, and this has been changing since the advent of the Accountable Care Act, but many departments have really lacked the kinds of funding, even for just equipment and technology, to reduce human error. And yet they're the ones that are taking instruments that a lot of people think there's brand new instruments going into the OR every time. They don't realize that those instruments, if there's, 6 of those orthopedic cases that day, maybe one of those sets comes back down, gets cleaned, gets disinfected, gets reassembled, gets sterilized, and then gets put on the shelf to go back up into another surgery. And so, inspecting those instruments,
right? I mean,
right.
Yeah. And we talked about this earlier. One of the things we see on the technology side is a lot of these life-saving devices or monitoring devices really haven't been designed necessarily with a whole lot of forethought into that cleaning and repurposing procedure. And we see it all the time. I love to use the example of the infusion pumps, which are in just about every acute care room, hooked up to patients. And all these infusion pumps have like a 200-page cleaning manual. And on the last page, it says, don't clean the screen. Well, that's the touchpad point. There's not necessarily a solution for some of these wands, a lot of the probes. And you're right, people take it for granted that, they just took it out of the package, it's brand new and perfectly sterile. You hope it's sterile because someone's responsible for that, right?
Yeah, I just saw a great presentation. Our whole team for Beyond Clean at our annual meeting 2 days leading up to the HSPA conference in San Antonio this year. HSPA used to be known as ISHM. It's the Professional Trade and Certification. It's a professional trade organization and one of 2 certifying bodies in the sterile processing industry. And one of the presentations I saw was literally a study on probes. And that's really kind of this uncharted territory in terms of, infection prevention and opportunity. The thing that happens with sterile processing is they become a catch-all. So a lot of times hospitals want to see productivity metrics to help justify staffing models and things like that. But, the pumps don't always go to sterile processing. Sometimes they do, sometimes they don't. So the way that these, hospitals and healthcare organizations sort of divide responsibilities makes it difficult to compare one hospital to another hospital. And so that was a really, eye-opening one, because they had done, microbial studies and identified the opportunity, through quantifying bacteria on those probes, and what that opportunity was for improvement. So, definitely, I think what you're talking about is huge. What's interesting is the surgical instrument realm because of the FDA 510K and for reprocessing, and because they're surgical devices, we still see a lot of opportunity. And you talk about the manual, it's the instructions for use, or the IFU as everybody refers to it in SPD. Right. That manual can have a lot of steps to it. And so, it's not necessarily like housekeeping where you walk into one patient room and it's the same as the next patient room in terms of the process. There's a lot of variables, even from one manufacturer to another. And this is the area when you talk about technology or automation or equipment. How does one person with less than 6 months of experience come into that job and have all that information sorted out in terms of it? It's almost institutional knowledge because it depends on their equipment mix too. How do they get a handle on that? So to your point, like some real standardizations in order here in conjunction with more investments in equipment and technology.
Well, and to your point, one of the challenges is the infinite variables. So even if you have the best practice processes for sterile processing, there's so many variables just in the environment alone. You can follow all of the procedures, but then are the instruments laid out in dirty air? How do you know it's not dirty air? What is the environment like? There's just so many variables and not enough standards, I guess, to try and reel in all of these variables to end up with the best result. Would you agree with that?
Yeah, I would totally agree with that, especially in the area that you're talking about, because if you're looking at sterile storage, there's air exchange requirements in sterile processing, whether it's clean and dirty. You have a positive pressure and negative pressure, environments in the operating room. And this is all about having the air flow from the cleaner or sterile environment towards the dirty, or lesser clean environment. But there's also temperature and humidity controls. Once you start getting into more like less regulated storage areas, to your point, then that air exchange and temperature and humidity, it's not necessarily controlled like you would in the actual procedural areas.
Right. A lot of variables to deal with. Now, I know when you started the company, Beyond Clean, that the focus was on the sterile processing area. How did that come about? And then talk about the evolution into the other podcasts that you host that you mentioned as well.
Yeah. So what's really great, if you go to beyondclean.net, you'll actually be able to see our story. My co-founder, Hank Balch, had just run for the presidency of ISHM, now HSPA. He didn't win. It was a pretty high profile election, and I'll leave it at that. But coming on the heels of that, he had done a lot of work to cultivate an audience on social media. And if you go to LinkedIn and just, search hashtag sterile processing or hashtag SPD, you'll see that there is an incredibly engaged community of sterile processing professionals there. And I'd say, Hank realized that and is an exceptional writer and really a social media guru. I knew I had done podcasting and I had been successful with that. And I had a really good process, but it was more of a pastime, not something I had done professionally. I decided at that point, as I was talking about having been an entrepreneur, that I really should start looking at starting a podcast, especially in sterile processing, because that's where my experience base was, even as an educator and a sales representative. And somebody I worked with at the time said, are you following Hank Balch? He's got a really unique message, really engaging on LinkedIn. And so I went and looked him up. And the next time I saw that coworker, I said, you're right. He's amazing. I said, if I was going to start a podcast with somebody, that's who I'd want to do it with, somebody who already had an audience. And he said, you should do it. You should do it. And so I think it was like 12:30 at night. I reached out to Hank on LinkedIn and sent him a message. We started that podcast and we didn't meet until 9 months later at the first HSP or ISHM annual conference, that spring. And we had started recording in August the prior year. So that's how it took off. He said yes. And then from there, the brand really, built quickly. We weren't building it initially for any other reason than, to help create awareness for Hank and his budding consulting business. And then myself just wanted to take my regional presence and make it more of a national presence. We realized over time that there was a lot of opportunities. Hank was building 2 different media brands, and he said, what if I just take my consulting business and put it under Beyond Clean? I was like, no problems here, no point to duplicating your effort. So we wrapped it up underneath that. And honestly, as far as hospital consulting goes, Hank's done not a lot of that since then. We've consulted a lot on social media strategy, content creation. We create content for our partners. I mentioned the virtual conferences, lots of other things, CE approved content. So really with that educational focus, even when we create content on social media, it's not meant to be pitchy. It's meant to always provide more value to the audience than we're asking them to give, especially when it comes to listening to the podcasts or contributing to social media content or attending a conference. So that's where it kind of took off. And then as far as the other brands, we had lots of people from peri-op and even supply chain materials and infection prevention that were watching and listening and participating in the things that we were doing at Beyond Clean. But people would come to us and say, do you know how much of your audience represents the OR supply chain? And we said, well, we know they're there, but really we hadn't cultivated content for those audiences in mind. And that's where it just naturally grew. It's like, well, wait a second. We want these brands to work together, but we want them to create content that's, for perioperative professionals, for SPD. But then by overlapping them, we can start to break down the silos. So even our conferences now are collaborative. Like you'll see a conference where Beyond Clean will do a conference with Power Supply, and we'll have conversations that overlap between supply chain and sterile processing or infection prevention and OR. And then I think that's really that's the biggest need in healthcare. We got to break down these silos so there's mutual awareness and collaboration.
I just want to reiterate one point you made, because I think it's a huge differentiator for you. The mission is to educate and inform, but you're actually providing that continuing education that's required for these clinicians, right? Can you talk a little bit about how that works and how people take advantage of that?
Yeah. So all of our podcasts on Beyond Clean are approved for CE credits from the 2 certifying bodies, that's CBSPD and now HSPA. Our conferences get approved ahead of time. We were actually the first company ever to work with one of our partners to create social media content that was approved for CE credits. So groundbreaking effort. On the operating room side, we've partnered with CCI, and they're the credentialing and certifying body for perioperative nurses. They have several certifications. They're really built around competency, which kind of takes me to a second effort that we've partnered with them. But select episodes from the First Case podcast are available for CE credit. We also are approved by CBRN. So our conferences get nurses credits as well. And then we did something also very unique in the industry, which is we brought the first sterile processing micro credential in our partnership with CCI. And so that's not just for sterile processing professionals. It's not just for OR. We have infection preventionists that are taking that micro credential. It's just offered through CCI. So another groundbreaking educational opportunity out there. And it's built around competency. The person, Lisa McCown, who developed that micro credential with Beyond Clean, she actually grades them. There's an essay. So, it's not just multiple choice questions. It's truly about evaluating competency. And then currently for power supply and transmission control, we're pushing forward on having those podcasts be approved for continuing education credits as well. And power supply is well on its way in our conversations with ARM.
Now, you also mentioned virtual events. Now, is this something that was in the original business plan, or is this a result of COVID? Because as many of us know that go to trade shows during the COVID time, that all had to be virtual or be dismissed altogether. Can you tell us a little bit about the virtual events that you host?
Yeah, there were a couple of things that we had just started doing about 6 months prior to the pandemic. One of them was something called Beyond the Tour, which if you go to the Beyond Clean YouTube page, you'll see that we filmed 2 episodes. And those episodes are kind of like how it's made combined with what is it? Dirty Jobs, how it's made. Well, but it really is kind of an inside look in the culture of a manufacturer, but also shining a light on gaps in the sterile processing industry, trying to make that entertaining. And again, as we talked about increasing awareness for the general public of sterile processing, we thought, a 30-minute TV show kind of format would be a great way to do it. We filmed 2 of those episodes, and then the pandemic hit. There's no more in person. And we have plans to start filming those episodes again. But that was a huge endeavor and a project for us that got totally shelved. The other project that we had started was in-person live events and conferences. We'd had our first one in collaboration with CCI. It was held in Houston the fall before the pandemic broke. We were having our second one in Minnesota like days before the pandemic hit. I had just been out to Portland, Oregon, and had come home and then flew out to Minnesota. We had our annual team meeting again then. And then we had this huge conference in Minnesota for sterile processing. And then about 5 days later, the world shut down. We had a large manufacturer organization that had committed to 6 of those live events for the year. And coming on the heels of the pandemic, knowing that we weren't likely going to be doing any live events for a while, Hank and I kind of rallied the team together and had a conversation and said, look, we don't want to scare you, but, a lot of the suppliers with surgeries being canceled, a lot of our partners, they may not be committing funds. They may be contracting budgets significantly. This could have a huge impact on us. If they're not running surgeries, they're not going to need consulting services. You should all start looking for, other methods of employment. That's where the conversation was, in March. By the end of April, we had our very first virtual vendor expo. We do something called SPX, Sterile Processing Expo. And so we took the annual conference vendor expo portion of it and we held it online. And then we had our very first virtual conference all day at the end of that week. So we brought this, and this was in 1 month. At the beginning of March, we're talking about this isn't going to happen. You should start looking for second jobs. And by the end of April, we had basically recreated an in-person event online. We reacted and pivoted very quickly. It turned out our partner stayed with us and converted all of their live events to virtual conferences for the rest of that year. And our model and our ability to reach an audience that they were not able to visit in person anymore wound up being a significant strength. I'd still take the pandemic back any day of the week. The impact on our personal lives, the impact on so many people. I'd throw it away in a heartbeat. But for our business, it wound up being fortuitous because Hank always said, by the time you need a social media presence and audience, it's too late. You've got to start cultivating it now. We had done that. And as a result, we grew over 50% during a time when many organizations were really struggling to figure out how they were going to get, through those times. We all felt really grateful and fortunate. And we also anticipated a retraction as the country started to open up again. And that we might, that might have been a really good year for us, but we should expect things to wane. And that hasn't been the case. I think it taught everybody a lot of important lessons, and we changed how we did business. And so we were very fortunate to have been poised for it. It's not what we expected. And for everybody that's, worked with us over the last several years, we're grateful for their support and glad that we could provide mutual value, to both parties, including the audience. They were so used to getting education in sterile processing. There were all kinds of things that had audibled during that time. How would they get that information? And they were able to get it from us. We continued to push out lots of content and engage sterile processing and, continue to fuel their passion throughout that year. And so it wound up working out well. But as I said, I'd still take the pandemic back and grow slower.
Of course. But I love the story that, hey, we're all sitting around talking about looking for jobs. We pivot, we find our value. succeed in our mission and have a degree of success. I think that's fantastic. What about predictions for the future? Predictions for Beyond Clean? Where do you go from here? And what about the rest of the world as we are struggling to ride through COVID and getting back into the way we used to do things, maybe tweaked a little bit? What predictions do you have for our audience?
Yeah, definitely tweaked a little bit. We're going to see a lot more hybrid events. I think everybody has realized that there's a lot of value in social media, but I still think most companies and even healthcare organizations don't understand how to utilize that value. I think there's a lot of growth in that area. I definitely am not sure that everybody understands that education should be the strategic heart of your social media campaigning. No matter what it is, even as a healthcare organization trying to reach the community, it should be educational in nature, not promotional. That's something I don't think that everybody in the industry has fully comprehended. And I really appreciated you noting that early in our interview, that's kind of a differentiator. But I think it's a key component with or without continuing education credits. It just goes back to what value are you providing? If you want people to take the time to listen to what you have to say, you have to think long and hard about the value that you're giving them in that interaction. So I think live events too. One of the things we're definitely seeing as we kind of look out to a lot of the conferences that are coming back, people are starving for that interpersonal, in-person kind of, getting back to that. At the same time, organizations have learned that they can still do business without paying for travel. And so, I think a hybrid approach is going to be the best way to succeed. And I think that's what we're going to see in the future. We're looking at taking our virtual conferences and sort of hybriding it where it's a live in-person conference, but then it's streaming virtually at the same time so that you can cast a wide net. And then the people who have either not the funds or their organizations don't support travel, I think we're going to see that they're very grateful to still be able to access that content, even though they may be limited. I think another shift is a lot of people did a lot of these annual events. And I think you're going to see a lot of these professional trade organizations focusing on how do they grow their regional chapters, because that's an area where if you can provide value regionally, all of those folks that are not able to go to, get the travel expenses, et cetera, for those national events, that's a great way to continue to provide value to them and easier for them to go and participate in those events. I do think that social media strategy will evolve significantly. I think one of the other things that happens with a lot of marketing departments when it comes to social media is they're not exactly sure how to instruct, internal and field-based people how to utilize that content. And I think a lot of field-based folks are a little afraid because they think if they share something or say the wrong thing on social media, it's documented. And then all of a sudden, they're going to be penalized for saying the wrong thing. So what we'll typically see is either a marketing team that really wants to push social media content, but the field-based teams won't do it. They won't buy in. They don't trust it. Or I'll see it the other way where the marketing, sort of strategy is very restrictive. And you have people in the field that really do want to leverage social media, but they're kind of instructed not to. I think sophistication and strategy with field and marketing that's where we're going to see a lot of best practices evolve. There's going to be some bold players in the market that know how to strike a balance. One of our partners has had a strategy where they require, their field-based team members to post 2 to 3 times on social media, even if it's just a resharing of an educational article. But or if it's something that's a company posting, but they're required to leverage that. So I think sophistication in that regard. I also think we're going to see lots of podcasts. When I started the Boston Celtics podcast in 2005, we were the only thing going. Now I can literally count 15 to 20 Boston Celtics podcasts 17 years later. And the same thing is going to happen in this space. There's going to be, even when we started 5 years ago and with Beyond Clean, there was only one podcast. Now the professional trade organization has one. I know of at least 6 or 7 sterile processing podcast. We're going to see lots more content creators, lots more people that are going to be bold. The one tip I have for anybody who's going to get started, and I bet, Brad, you will totally support this, you've got to be consistent. If you're not willing to commit to some sort of regular schedule and put out content to your audience that's growing so they know what to expect, it's probably going to wax and wane. So once you jump in, be consistent and keep doing it. Don't let it go.
Well, and I think it starts with a commitment to a quality mission and educating for the purpose of better outcomes in healthcare. Our
Absolutely.
guest today is Justin Poulin. The company is Beyond Clean. Justin, how can our audience find out more about your organization?
Yeah, you can go to beyondclean.net. The other websites are firstcasemedia.com, powersupplymedia.net, or transmissioncontrolmedia.net. And we also can be found on LinkedIn and Facebook. So if you've got a preference between the two, certainly would love it if you linked and connected with me on LinkedIn. You'll see links through to all of the social media pages on LinkedIn, on my profile account. Certainly follow us. Find us on iTunes, Stitcher, Spotify, Apple Podcasts, Google Podcasts, Amazon Podcasts. Would love it if you subscribe to any or all of our podcasts as well. And just be on the lookout on those social media pages for our live virtual conferences and events. The great thing is we have one of the premium, platforms for virtual conferences. So even if you don't make one live, as long as you register before it goes live, you'll be able to watch them later and in perpetuity after that. So all of that content is still made available. You can find it on beyondclean.net. And Brad, I just really appreciate you inviting me to join you today. I love podcasting. As you probably can tell, I love to talk. So it's a great fit. And this has been an excellent interview. So thank you so much for having me again.
Thank you, Justin, for being on the show. The company is Beyond Clean. You've been watching Clean Talk. For my guest, Justin Poulin, I'm Brad Whitchurch, reminding you until next time, keep it clean.